Hello, my name is Ramin Nilforooshan. I'm a consultant psychiatrist for older adult dementia specialist, and also I've been a researcher and been involved in many drug trials for Alzheimer's disease. When it comes to publishing the result of drug trials, the language that has been used to explain the cognitive decline for drug trials is very different to the language that clinicians they use for showing the decline in memory in any memory service. To give you an example, a person goes to a memory service. In most of the cases, they use one of the triaging screening tools like MMSE or MoCA, Montreal Cognitive Examinations. Sometimes they use ACE, Edinburgh Cognitive Examination, or some others. And those are the scales that majority of the clinicians are used to know the range and what does it mean as mild, moderate or severe. But when it comes to a drug trial, when a paper is published, they may use MMSE as one of the secondary objectives, but majority of their language is about using ADAS-Cog or CDR. And because many clinicians in day-to-day memory services, they're not using those scales, it's very difficult for them to understand what it means as a progression or decline in a memory of a person. It takes 5 to 10 minutes to do MMSE or MoCA, and a little bit longer, maybe 15 or 20 minutes to do ACE. And clinicians, they know those scales. They could easily do it, and also they understand the range. But when it comes to ADAS-Cog, this is the pack. And it got many objects that the person needs to name it. Also, it got list of words that you ask the person to repeat after you, and then if they could remember it. And if in MMSE or in ACE, they use 3 words or maybe a little bit longer an address in ACE, in this one is the range of 30 words and sometimes bigger numbers. So different way of assessing short-term memory. Also, as a screening object, when a person wants to get to a trial, they usually want the person to have MCI or mild Alzheimer's. So we use CDR, which is Clinical Dementia Rating Scale. And on this one, the score goes from 0 to 3. And also it's on 6 different domains, which is memory, orientation, or home and hobbies, and personal care. And this is something that information collected from the informant and also through the interview of the subject. And majority of the clinical trial that is being used nowadays, they want the person to score 0.5 or below, or sometimes 1 and below. It means mild dementia or questionable dementia. And I think it's important for clinicians to understand that this range is somehow matching of MMSE of 22 and above, or 24 and above, and sometimes 26 and above. It depends on the range that they use. I think it's important that clinicians understand that these scales are being used in research, and also they get familiarized to the range that is being used. Thank you very much.